Hello all, today we are going to discuss about Atheromatous disease. First of all, we can see what is Atheromatous disease. So, Atheromatous disease, also known as atherosclerosis. It is a condition where plaque build up inside arteries. This plaque is made up of fat, cholesterol, calcium and other substances found in blood. Over time, this buildup can harden and narrow arteries, limiting the flow of oxygen-rich blood to the organs and tissues. Next, we can see about arteriosclerosis. So, what is arteriosclerosis? So, arteriosclerosis happens when the blood vessels that carry oxygen and nutrients from the heart to the rest of the body become thick and stiff. These blood vessels are called arteries. Healthy arteries are flexible and elastic, but over time, the walls in the arteries can harden, a condition commonly called hardening of the arteries. Clinical features for atherosclerosis. Atherosclerosis often develops silently, and many people don't experience noticeable clinical features until the arteries become significantly narrowed or blocked. The symptoms that do arise on which arteries are affected. Common coronary artery disease affecting artery supply of heart are angina, that is chest pain, tightness of chest, shortness of breath, especially during any activity, then heart palpitations. Other symptoms that occur during a heart attack include cold sweats, dizziness, extreme tiredness or weakness and nausea. Then carotid artery disease that affecting the artery supply of brain. So first we can see the transit ischemic stroke. Transit ischemic stroke is also known as mini stroke. So, sudden temporary symptoms like weakness, numbness on side of the body face, difficulty in speaking, slurred speech, vision troubles in one or both eyes, dizziness or loss of balance. These are the warning signs of potential stroke. Then stroke. If carotid artery becomes completely blocked, it can lead to a stroke with more permanent and severe symptoms. For peripheral artery disease that affecting the arteries of limbs, usually legs. Intermittent claudication, pain, cramping, aching, heaviness in the legs muscle, calf tight or buttocks, calf thigh or buttocks. That occurs during walking, exercise and is relieved by rest. Then change in skin, painless or bluish discoloration of skin on the affected limb, poor wound healing, numbness or weakness, decreased pulse. Then renal artery stenosis. In renal artery stenosis, we can see high blood pressure and kidney dysfunction. And then mesenteric artery ischemia. Mesenteric artery ischemia that affecting artery supplying the intestine. So here we can see abdominal pain, weight loss, nausea, vomiting and diarrhea. Next we can see about the causes for atherosclerosis. Atherosclerosis is a disease that slowly gets worse. It may begin as early childhood. The exact cause is unknown. It may start with damage or injury to inner layer of an artery. Artery damage may be caused by high cholesterol, particularly high levels of bad cholesterol, that is LDL, can contribute to plaque formation. High blood pressure, so this can damage artery wall. Diabetes, inflammation like chronic inflammations like arthritis, genetics and family history, lifestyle factors, that is lack of exercise and unhealthy diet, high saturated and trans fat and obesity. Once the inner wall of an artery is damaged, Blood cells and other substances may collect at the injury site. These substances build up in the inner lining of the artery. Over time, fats, cholesterol, and other substances also collect on and in the walls of the heart arteries. This buildup is called plaque. Plaque also can burst, leading to blood clot. Next, we can see about pathophysiology. In pathophysiology, first the endothelial dysfunctions may happen, then liquid accumulation and modification, leukocyte recruitment and infiltration, form cell formation, that is accumulation of lipid laden macrophages, gives foamy appearance, hence name form cells. Then smooth muscle cells migrates and proliferation, plaque formation and progression, then plaque instability and rupture, thrombolysis, that is blood clot formation. Next we can see about diagnosis. So first we can take medical history and physical examination, then blood test like lipid profile test, blood sugar test, C-reactive protein, that is CRP. So CRP means it is a blood test marker of inflammation. It produces liver produce and rises when there is an infection and injury or inflammation in the body. Then non-invasive tests like ECG, echo, stress test, carotid ultrasound, peripheral arterial ultrasound, ankle brachial index, CT angiography, MR angiography, X-ray, coronary artery calcium scan, at CT scan of the heart that measures the amount of calcium in the coronary artery. Calcium deposits are a sign of plaque buildup. Then invasive tests like angiography. Next we can see about the management. Treatment of Atheromatous disease focuses on slowing down or halting the progression of plaque buildup, managing the symptoms and reducing the risk of serious complication of heart attack, stroke, peripheral artery disease. It involves lifestyle modification, healthy diet, regular exercise, quitting smoking, weight management and stress management. So medications like statins. Statins means bad cholesterol and stabilize plaque, reducing the risk of rupture. Then antiplatelet medications like aspirin and clopidogrel. Then beta blockers. Beta blockers helps in BP workload of heart and relieving chest pain. Then ACE inhibitors lower BP and also have protective effects on blood vessels. Then calcium channel blockers lower BP, relax blood vessels, helps to relieve chest pain. Then medications for diabetes, blood thinners. Then medical procedure and surgery. Angioplasty and stenting. So this angioplasty and stenting is commonly used in coronary artery and can also used in other arteries. The next one is bypass surgery. A surgical procedure via a healthy blood vessel from another part of the body, example from leg, chest, is used to create new route for blood flow around blocked arteries. These are often used for severe blockages in coronary arteries or peripheral arteries. The next one is thrombolytic therapy. So in thrombolytic therapy, the blood clot is dissolved and restore blood flow in sudden heart attack or stroke caused by blood clot. The next one is carotid end arteriectomy. So it is a surgical procedure to remove plaque buildup from carotid arteries in the neck to reduce the risk of stroke. Thank you.